When a CNA discovers a small fire in a resident's room, what should be done first? A. Attempt to extinguish the fire. B. Rescue the resident from danger. C. Activate the fire alarm. D. Close all windows. Answer: B. According to the RACE protocol, rescue, alarm, contain, extinguish, the CNA must first remove the resident from immediate danger before taking any further steps. Safety of the patient comes before fire control. What should a CNA do if a resident is found on the floor after a fall? A. Help them stand up immediately. B. Leave them to get the nurse. C. Check for injuries and call for help. D. Move them back to bed. Answer: C. The CNA must stay with the resident, assess for visible injuries, and call for nursing assistance. Moving the resident before evaluation can worsen hidden injuries like fractures or internal bleeding. The CNA notices frayed electrical cords on medical equipment. What is the correct action? A. Tape the cord temporarily. B. Continue using it carefully. C. Report it to maintenance immediately. D. Try fixing it. Answer: C. Frayed electrical cords pose a serious fire and shock hazard. CNAs must never attempt repairs and should report the issue to maintenance or a supervisor immediately. During an earthquake, what should a CNA do first? A. Evacuate the building immediately. B. Move residents under sturdy furniture or doorways. C. Pull the fire alarm. D. Open windows for air circulation. Answer: B. In an earthquake, protection from falling debris is the top priority. Moving residents to safe spots like under tables or doorways prevents injuries until shaking stops. A CNA sees smoke coming from the laundry room. What should they do after rescuing anyone inside? A. Try to extinguish the fire. B. Run outside. C. Activate the alarm and close the door. D. Remove all laundry. Answer: C. After rescuing anyone in danger, the CNA should activate the fire alarm and contain the fire by closing doors. This limits oxygen supply and prevents the fire from spreading. When a resident is choking and cannot breathe or cough, what should the CNA do? A. Start chest compressions. B. Perform the Heimlich maneuver. C. Give sips of water. D. Wait for the nurse. Answer: B. The Heimlich maneuver, abdominal thrusts, is the immediate intervention for complete airway obstruction in a conscious adult or child to expel the foreign object. What is the safest way to identify a resident before giving care? A. Ask the roommate. B. Check the resident's wristband. C. Ask the resident their room number. D. Confirm with another CNA. Answer: B. The wristband provides the most reliable identification and must always match the care plan or chart before performing any procedures. If a resident's oxygen tubing becomes disconnected, the CNA should first: A. Reconnect the tubing. B. Call the respiratory therapist. C. Turn off the oxygen. D. Notify housekeeping. Answer: A. Reconnecting the tubing ensures oxygen flow is restored immediately. If the issue persists, the CNA must report it to the nurse promptly. To prevent accidents when transferring a resident from bed to wheelchair, the CNA should: A. Use a gate belt and lock the wheelchair. B. Move quickly to avoid strain. C. Let the resident grab the CNA's neck. D. Pull the resident by the arms. Answer: A. Locking the wheelchair and using a gate belt ensures stability and control during transfer, reducing fall risk for both the CNA and the resident. When handling hazardous materials, CNAs should always: A. Use gloves only. B. Read the safety data sheet, SDS. C. Ask another CNA how to handle it. D. Dispose of it in regular trash. Answer: B. The SDS provides essential information about proper handling, storage, and disposal of hazardous substances to ensure workplace safety. What should a CNA do if they notice a spill of an unknown liquid in the hallway? A. Wipe it immediately. B. Leave it alone. C. Block the area and report it. D. Mop it later. Answer, C. Blocking access and reporting prevents slips and potential exposure to hazardous substances. Safety must be prioritized over cleanup speed. When using restraints, CNAs must A. Apply them tightly to prevent movement. B. Ensure a physician's order is in place. C. Use them for staff convenience. D. Keep them on at all times. Answer, B. Restraints are a last resort and require a physician's order. Improper or unnecessary use violates patient rights and can cause injury. If a resident's clothing catches fire, what is the first step? A. Run for water. B. Stop, drop, and roll. C. Cover them with a blanket to smother flames. D. Use a fire extinguisher on the body. Answer, C. Covering the person with a blanket removes oxygen from the fire. Water or extinguishers can worsen burns if not used correctly. The CNA finds a resident unresponsive on the floor. What should be done first? A. Call for help and check for breathing. B. Move the resident to bed. C. Start CPR immediately. D. Check their medication list. Answer, A. Checking responsiveness and breathing is essential to determine if CPR or other interventions are required. Calling for help ensures prompt assistance. If a resident complains of chest pain and shortness of breath, the CNA should A. Assist the resident to lie flat. B. Leave to find the nurse. C. Stay with the resident and call for help. D. Offer water. Answer, C. The CNA should stay with the resident, ensure they remain calm, and immediately alert the nurse for potential cardiac emergency intervention. During a tornado warning, residents should be moved to A. The highest floor. B. Rooms with windows. C. Interior hallways or bathrooms. D. The dining area. Answer, C. Interior hallways or bathrooms provide better structural protection from debris and wind during tornadoes. When lifting heavy objects, CNAs should A. Bend from the waist. B. Keep knees bent and lift with the legs. C. Keep feet close together. D. Twist the back while turning. Answer, B. Proper body mechanics reduce the risk of back injury. Keeping knees bent and using leg muscles provides better control and strength. Which action helps prevent workplace injuries for CNAs? A. Ignoring small spills. B. Using mechanical lifts properly. C. Rushing through tasks. D. Avoiding assistance. Answer, B. Mechanical lifts minimize strain and prevent musculoskeletal injuries during transfers and repositioning tasks. A CNA finds a resident smoking in a non-smoking area. The correct response is A. Ignore the behavior. B. Take away the cigarette immediately. C. Report the situation and move the resident to a safe area. D. Scold the resident. Answer, C. Safety must come first. The CNA should calmly move the resident away and notify the nurse to handle the violation safely. When transporting oxygen equipment, CNAs must ensure A. Oxygen tanks are secured upright. B. The tank is placed on the bed. C. Smoking is allowed nearby. D. Tubing is removed. Answer, A. Oxygen tanks must be secured upright to prevent leakage or explosion. Safety precautions prohibit open flames or smoking near oxygen. If a resident begins to have a seizure while in bed, the CNA should A. Restrain the resident to prevent injury. B. Insert an object into their mouth. C. Move objects away and protect the head. D. Call for help and leave the room. Answer, C. During a seizure, the CNA should ensure the resident's safety by clearing nearby hazards and cushioning their head. Inserting objects or restraining movement can cause harm. The CNA must stay with the resident until the seizure ends. When evacuating residents during a fire, which group should be moved first? A. Independent ambulatory residents. B. Residents closest to the fire. C. Bedridden residents. D. Residents in the dining hall. Answer, B. In a fire, those in immediate danger are evacuated first to ensure survival. Once safe, CNAs can assist residents farther from the danger zone following facility evacuation plans. The best way to prevent the spread of infection during emergencies is to A. Use alcohol-based sanitizer for all situations. B. Wear gloves only for wound care. C. Practice proper hand hygiene before and after each contact. D. Rinse hands with cold water. Answer, C. Hand hygiene is the cornerstone of infection control. Washing hands before and after resident care minimizes the risk of transmitting infectious agents, especially during emergencies. A resident is found slumped in a wheelchair and unresponsive. The CNA's first action should be to A. Move the resident to bed. B. Shake the resident and call their name. C. Call the family. D. Look for a pulse without checking responsiveness. Answer, B. Checking responsiveness by calling and gently shaking the resident helps determine consciousness. If no response, the CNA must call for help and begin emergency procedures as trained. When a resident is on contact precautions, the CNA should A. Wear gloves and gown when entering the room. B. Only wear gloves if touching bodily fluids. C. Remove PPE outside the room. D. Dispose PPE in hallway trash. Answer, A. For contact precautions, PPE must be worn before entering and removed before leaving the isolation area. This prevents the spread of infectious organisms to other areas. During an evacuation, if elevators are working, CNAs should A. Use the elevator to speed up evacuation. B. Only use elevators for ambulatory residents. C. Avoid elevators and use stairways. D. Wait until staff gives permission. Answer, C. Elevators should never be used during a fire or emergency evacuation because of the risk of electrical failure and smoke entrapment. Stairs are the safest evacuation route. A CNA finds a chemical spill in a medication room. What should be done first? A. Clean it with towels. B. Evacuate the area and report it. C. Mix bleach to neutralize it. D. Continue working. Answer, B. The CNA must immediately clear the area and report the spill. Some chemicals can release toxic fumes or cause burns, so trained personnel should handle cleanup using proper protective gear. When transferring a resident with a weak left side from bed to wheelchair, where should the wheelchair be placed? A. On the resident's right side. B. Directly in front of him. C. On the left side. D. At the foot of the bed. Answer, A. Placing the wheelchair on the stronger side allows the resident to use their strong arm and leg for support, ensuring a safer and more stable transfer. If a CNA is exposed to a resident's blood, what should be done immediately? A. Wipe the area and continue working. B. Wash the area with soap and water and report it. C. Cover it with a bandage and ignore it. D. Wait until shift end to report. Answer, B. Blood exposure poses risk of infection. The CNA must wash the area thoroughly, report to the supervisor, and follow facility protocol for exposure documentation and testing. To prevent burns when assisting with hot liquids, the CNA should A. Carry cups filled to the top. B. Test temperature before serving. C. Serve quickly to avoid spills. D. Allow residents to test first. Answer, B. CNAs must test the temperature of hot items before serving to ensure safety and prevent scalding. Residents with reduced sensation are especially at risk.